Hello and welcome to the special podcast feature for The Great COVID Panic by Colin M. Barron. It's a great pleasure to have Colin Barron, the author of the book, here with us today to talk a bit about his book, why it's so controversial, and the many different findings that he has come up with throughout the course of the book. So Colin, thank you for joining us today.
Thank you very much, Tom.
The Great COVID Panic is arguably your most controversial book to date, and it contains a lot of criticisms of the way that the government handled things during the pandemic. What would you say is your greatest criticism of what was done back in 2020?
My main criticism is that they locked down the whole country, shut down businesses and paused the NHS in order to deal with a virus which was no more deadly than a severe flu. At the time, I had my reservations about lockdown. Even in 2020, lockdown was described by many experts as the largest scientific experiment ever carried out without a control group. In fact, there was a control group, namely Sweden, which had no lockdowns and no mask mandates and did far better than Britain. It suffered little damage to its economy and health service and had lower per capita deaths than Britain. Later on in the pandemic, some American states chose not to lock down and not insist on mask wearing, and they did better than US states which had these measures in place.
But surely lockdowns must have worked at least to some capacity. After all, if you stay in your own house, it stands to reason you can't catch COVID. So what have been the damaging effects of the lockdowns?
Well, you might think that you can't catch COVID if you stay at home, but what we now know is that lockdowns merely delayed the onset of COVID infections. They did not prevent them. So instead of contracting COVID this week, you get it in 2 weeks. Admittedly, there wasn't a lot of research to confirm this in March 2020, but 4 years on, there are now over 100 peer-reviewed scientific papers which prove that lockdowns cause more harm than good. As Peter Hitchens put it so succinctly, the government burned down the house to get rid of a wasp nest, and then they did it twice more. There were 3 UK lockdowns, and each time lockdown started, the number of cases of COVID had already peaked and was starting to fall. So if we had done nothing, we would have had the same outcome.
So what have been the damaging effects of lockdown?
As a result of repeated lockdowns, the world is drowning in a sea of debt. In the UK alone, lockdowns cost several £100 billion, about 3 times the annual budget of the NHS. And it is that which has caused rampant inflation, the demise of many businesses, huge tax rises and the cost of living crisis. NHS waiting lists are at an all-time high, and GP, A&E and dental services have been badly affected.
So what should the government have done then, in your opinion?
They should have done what was outlined in their 2019 pandemic plan and was later described in the so-called Great Barrington Declaration. The elderly and the vulnerable should have been encouraged to stay at home as much as possible. Anyone who contracted COVID should also have stayed at home unless they required hospital treatment. Meanwhile, healthy, young and middle-aged people should have gone to work as usual. The NHS should have continued as before, and the virus would have spread through a relatively young population, resulting in herd immunity. The average age of a COVID death was 82, with an average of 3 underlying conditions. The virus was really no threat to most people under 65 without underlying conditions, but the government behaved as though it was the Black Death, with all its panicky pronouncements and constant fear-mongering.
Now, in your book, and I found this most interesting, you've explained how inaccuracies in COVID testing led to the perception that there was a global pandemic, when in actual fact there wasn't. Could you explain this in more detail, please?
The default method of COVID testing during the pandemic was the PCR test. This involved shoving a large swab like a giant elongated Q-tip up the nose. Unfortunately, the PCR test was inaccurate as it had a high false positive rate. This meant that many people were diagnosed as COVID cases when they really had nothing wrong with them. And anyone who died within 28 days of a positive PCR test was put down as a COVID death, even if they were run down by a bus or stabbed to death. This led to a gross overcounting of COVID cases and COVID deaths. We now know that there were no excess deaths in 2020. If you take the number of COVID deaths in 2020 and add them to the number of flu deaths the same year, it is much the same as the number of flu deaths in 2019. And that is why some people have claimed that there was no pandemic in 2020 and it was just a statistical and psychological trick. Before the vaccines arrived, many politicians thought the way to solve the crisis was to test as many people as possible. But that was a really dumb idea. The more people you test, the more cases you find, and the greater the panic. What the government should have done was stop all testing and ban the mainstream media from covering the so-called pandemic. Then the world could have gone back to normal in 2020.
And of course, famously, the government introduced so-called non-pharmaceutical interventions, or NPIs, to mitigate the effects of the virus. What's your opinion of them?
They were useless. In particular, they were social distancing, usually 2-metre social distancing, in which people were required to keep about 6 feet apart in the mistaken belief that this would reduce the risk of infection. In fact, as any medical student knows, when we cough or sneeze, the spray can travel up to 30 feet. So you would really need to have 10-metre social distancing for it to have any effect. One of the many false assumptions made by the government was that COVID spread by large droplets and that plastic screens and wiping down surfaces with disinfectant would prevent infection. We now know that this belief was wrong. COVID is airborne and spreads by means of a fine aerosol which can travel large distances, and this is one of the many reasons why face masks don't work.
Now, I'm glad you mentioned face masks. I mean, surely a contentious topic if ever there was one. In the UK, they were mandated from July 2020 onwards. How did that come about?
A lot of studies had been done on masks and viral respiratory infections before 2020, and the conclusion had always been that they are of no help in preventing the spreads of colds and flu. And that is why the British government originally advised people not to wear masks, as they could increase the risk of infection. Then in July 2020, the government made a U-turn and advised that masks should be worn in certain situations. This change in the government's position did not come about because of new scientific evidence. It resulted from political lobbying from globalist organisations, which included a pressure group called Masks for All, which had links with the World Economic Forum. Since then, there have been a number of scientific papers which confirm that masks don't stop the spread of COVID. For example, there was the so-called Danish mask study, which came to this conclusion. The authors of this report tried to get their paper published in a prestigious medical journal, but it kept being rejected, probably because of political pressure. It was eventually published in the Annals of Internal Medicine. Since then, there has been a Cochrane collaboration review, which was a meta-analysis of every paper ever published on masks and viral infections, and it concluded that masks were of little or no value in the prevention of COVID infections.
So, why exactly don't masks work? Could you explain in more detail?
It is quite simple. All face masks have small holes in them, too small to be seen by the naked eye, but these holes are much bigger than virus particles. So COVID virus particles can pass through them as easily as mosquitoes can pass through the holes in a chain link fence. Face masks will stop large droplets of mucus, but they don't stop a fine aerosol, which is how COVID spreads. In addition, there is always a gap between the mask and the face through which this viral aerosol can pass.
Now, playing devil's advocate for a moment, we know that surgeons, for instance, wear face masks during operations. Why would they wear them if they don't work?
Well, that's a good point. Many years ago there was a clinical trial in which a group of surgeons wore face masks during operations for 6 months. And then they did operations for 6 months without wearing face masks. When the results were calculated for the 2 time periods, there was no difference in the post-operative infection rate between the 2 time periods. So masks aren't needed during operations, but most surgeons still wear them, partly through habit and partly through cognitive dissonance. To explain what cognitive dissonance is, people often have beliefs about a certain subject, but when they're presented with information which conflicts with this belief, they reject the new information.
So, by that same logic, do you feel it's actually harmful to wear face masks?
It certainly is. They cause psychological trauma, skin infections, mouth infections, and lung infections, and dry eye syndrome. And the synthetic fibres which face masks are made of are often inhaled, possibly increasing the risk of lung cancer in later life. And the prolonged hypoxia and hypercapnia, which is increased CO2, causes the death of brain cells, leading to an increased risk of dementia at a later date. After just 20 minutes use, a face mask is soaking wet and loaded with bacteria. But many people will not bother to change, discard, wash or sterilise wet masks. They just put them in their pocket and wear them the next day, resulting in an increased risk of skin and mouth infections.
And lastly, we come to the contentious subject of vaccines, perhaps the most controversial of all topics related to the pandemic. What is your view on them?
Well, I am not an anti-vaxxer. If COVID vaccines had no adverse effects and stopped people from catching COVID, then they would be a good idea. But the mRNA vaccines that have been produced so far don't stop you catching COVID and don't stop you passing it on. The reason for this is that they do not cause the production of neutralizing antibodies, which would stop you catching COVID. They only cause the production of antibodies against the COVID spike protein. So at best, the current COVID vaccines result in a slightly milder illness and a slight decrease in the number of people dying or going into hospital. But it is a fairly weak effect. According to Andrew Bridgen MP's analysis of ONS statistics, 20,000 people have to be vaccinated to prevent one COVID death, and 1,500 people have to be jabbed to stop one admission to an intensive care unit. And any protection the jab gives doesn't last very long. The vaccines take 2 to 3 weeks to work, and any so-called protection they offer wanes after just a few weeks. So even if you get 2 jabs per year, you will only be protected for about half the year. And according to Professor Angus Dalgleish, it is likely that the jab only gives you protection against an earlier variant of the virus, not the current one. Professor Angus Dalgleish has also suggested that instead of going for a vaccine which stimulates antibody production, the pharmaceutical industry should have produced a vaccine which stimulates T-cell immunity, which is long-lasting. This would also have avoided all the side effects of the mRNA vaccines, which can be very serious and even result in death. And it is known that if you take an mRNA jab, you have a 1 in 800 chance of a serious adverse effect. The side effects of the COVID jabs are now well known: heart problems such as heart attacks, pericarditis and myocarditis, strokes, convulsions, neurological conditions such as Guillain-Barré syndrome, and blood clots. And there have been alarming reports that huge fibrin clots have been found in the vascular system of people who have died following COVID jabs. These fibrin clots appear to have been the cause of death. Unfortunately, to date, the government doesn't seem interested in these reports, but it is a national scandal. And Professor Dalgleish has claimed that many dormant cancers have reactivated and spread following COVID vaccination. And the Centre for Disease Control in USA has now admitted that vaccinated people are more likely, not less likely, to contract COVID and pass it on. Andrew Bridgen MP has tried to get a debate on the large increase in excess deaths since the COVID jabs were rolled out, but on every occasion he has done so, the House of Commons has been almost empty, with only a few MPs staying for the debate. Finally, at the moment a number of court cases are pending round the world relating to the claimed efficacy of the vaccines, so it will be interesting to see how things develop.
Well, Colin, thank you for having taken the time today to discuss what has been an incredibly interesting and timely book. I certainly, when I was reading it, was fascinated by the depth and clarity of discussion that you go into when you're explaining very, very profound issues, not just medical but also socio-cultural and economic, relating to the pandemic. Surely one of the most contentious issues of our time, and one which I'm sure will continue to stimulate debate for decades to come. So thank you very much for having been with us today, to have talked about the book and to have explained a little bit about your findings.
Thank you very much, Tom.
The Great COVID Panic is available to buy from Amazon in both Kindle and paperback editions, and I hope that you will get your copy soon.